Yes, we've got a story that was actually sent to us by Dr. Bob Gill, and I'm going to show it quickly on the screen, because apparently they want to nationalize GP offices. You know, as socialists, we're kind of in favor of nationalization, aren't we? Kind of. Well, under workers' control, ideally. But I presume if it comes from this government, there's something quite different behind us. Good morning, Bob.
Morning.
What's this about?
You know, it seems superficially attractive, but we need to bear in mind the context within which this has been announced. So we have the Health and Care Bill going through Parliament at the moment. What the Health and Care Bill is designed to do is to turn the NHS into a budget, and a budget that is controlled by the private sector and services that are provided by the private sector. Now, currently there's an obstacle to that happening, and that is how GP surgeries are funded. So GPs have what are called capitation payments based on their list size. And what Javid has announced is a mechanism to remove the capitation-based list payment system from GPs, effectively making GPs into employees of the NHS. Now, that's great if you have a benign, publicly minded, publicly orientated, publicly delivered system, which is well regulated and treats its staff with dignity and decent terms and conditions. That is not what we have. We have an NHS on the precipice of US corporate takeover. And what this announcement does, it brings in the budgets which flow through GPs at the moment and hands them into the control of these new entities that are being created called integrated care systems. Now, the biggest problem we have is I could count on one hand the number of GPs who actually understand what this is. They are so busy, they are disengaged, and their union is keeping them deliberately in the dark. So most GPs haven't got a clue. It's taken 15, 20 years to repurpose general practice into the current state. And the current state is you have a two-tier system within general practice. So you have GP partners and you have salaried GPs. Now, salaried GPs are there to be exploited. That's what other GPs have done. So if you're a partner, you employ a salaried GP, give him 80% of the income generated from that list. And if you do that a multiple number of times, you have quite a profitable business. And that's exactly what has happened over the last 15 years. It was New Labour's GP contract 2004, which enabled this to happen, allowed this two-tier system to develop, but also allowed the private sector to come in and run GP practices for the first time since 1948. Now, it's often thrown at GPs, oh, you're private contractors, you're not really public servants. Well, you could argue that, but our income is dictated by government. We are trained by the NHS. We have a pension scheme within the NHS. Every bit of our activity is dictated by the NHS. We don't have private shareholders. We can't hide our money from the taxman. And until the decoupling of 2004, a doctor had to provide face-to-face medical services in order to earn an income. In 2004, that was decoupled. So I could sit back, subcontract all my work to a group of salaried doctors and never see a patient and still earn a decent income. That was New Labour in 2004. So unless you understand this background, these announcements in isolation may seem seductive, but it's a complete trap. And to my embarrassment, most GPs seem to have lost the ability to critically think or give a toss about what they're leaving to subsequent generations of doctors. And I'll paint a picture of what that will be. It will be salaried doctors controlled by profit-greedy, profit-seeking corporations which control public funds and will be allowed to control how much is spent on patient care. The less they spend, the more profit they make. That is a dystopian future.
Yeah, you just said the union, the GP union, presumably is keeping its members in the dark. Unite has been involved in a judicial review the takeover of some GP practices by a US health conglomerate. What are they called? Centenary? No.
Centene.
Centene, that's it, Centene Corporation. Is that a better approach? Is that working better? Is Unite on your side in that struggle? What's this review about?
Yeah, so it's a very narrow judicial review on the grounds of insufficient public consultation. So it's a very narrow argument. Well, let's step back a little bit. Centene were not a hostile corporation coming in and bullying, elbowing out these lovely GPs. No, you had a group of 6 GPs who expanded their control, took over practices, employed salaried doctors along the lines of what I've described, employed non-doctors, made the workforce as cheap as possible, provide absolutely useless care, and have created a profitable business, which they then decided to sell to Centene. So these GPs have sold out their patients. We need to get away from the delusion that all GPs are lovely and love their patients. No, the new system has rewarded the entrepreneurial, greedy GPs to sell out their patients and don't care about the standard of service that their patients will be getting in the future. So this judicial review is trying to block the decision, but the GPs are laughing all the way to the bank. They've made millions out of this deal. They want the deal to go through, but the patients are suffering as a result.
Crikey, that sounds pretty horrific. I'm going to bring in Ekua Bayunu now, who is involved in the Socialist Health Association. Hello, Ekua. And there's an election coming up soon, isn't there? Are you working closely with the unions and who are opposing these kind of
It's really interesting actually listening to you, Dr. Gill, because one of the things we need to look at is how GPs can be supported and work together in a collective to take collective action and to get better informed. And we have in the Socialist Health Association many members who are in Doctors in Unite, and so that's one of the key ways that we support our members have a relationship with unions is through their direct relationship with unions. So that will be the health unions, that will be Unite, Unison, we're affiliated with us, GMB. In terms of how we're directly trying to engage with unions in this struggle at the moment, the struggle has been to keep the Socialist Health Association socialist. And that is what we've had to focus on. Ever since I've become a member, that's been a fight. But now I think we're really moving forward. There's much less pressure, I think, coming on us in terms of the AGM coming on. I'm hoping there's going to be some continuity of leadership going forward, and that we can really then focus on the work that we've been doing. We've been doing a lot of campaigns supporting things, particularly opposing the health and care bill. I mean, the whole issue around the integrated care systems. Obviously, I'm from Manchester. It's sort of one of the leading councils that's been leading it, and very sort of proudly as a Labour-run council talking about how well they're doing. And it's like, I've been looking at trying to raise awareness amongst the council. This is not a good thing for the residents in Manchester, for the National Health Service. So yeah, in terms of our work with the unions, I think we've gone through a process of really trying to get the Socialist Health Association back on a firm footing, to encourage more members. And that's what I would be here to say, is get involved so that you can actually be part of the solution. And the next step will be to look at much more formal relationships with the unions. But I think it's just as important for us to encourage our members to work directly with the unions that they represent and work with. So an example would be, so I'm the inequalities officer for sitting on Central Council for the Socialist Health Association. On the 6th of March, we've got a sort of beginner's guide to health inequalities. It's a webinar, everyone can join. We have been targeting in terms of supporting, we need to rebuild a relationship with the shadow cabinet, you know. We also need to support on the ground health activists. So a lot of our members support the Keep Our National Health public campaign, the SOS NHS campaign, but we also need to look at how unions can be supported and informed through this process. So they're going to be all invited, because people think they understand what inequalities mean, and that's the I think the basis from which we can look at the challenges so that people become aware of the things that Dr. Gill's has been talking about in terms, and then what action they can take. That's what we're about.
Okay, thank you both very much. It's a really troubling period for the NHS. I think thank you for updating us on that. Thank you.